All right, let's think about the role that government does play in the healthcare system, especially since the system of care is growing more and more complex today. To try to create and influence healthcare policy and reach those three goals we discussed earlier in the module, the government has a variety of tools at its disposal. It can create government programs to provide health insurance, like Medicare and Medicaid. It can regulate individual behavior as it relates to it, something like the individual mandate that was put in place with the Affordable Care Act. It can engage in public education campaigns, like telling individuals to get a flu shot, or being more active to stave off diabetes. It can tax individuals to pay for these government programs, tax you if you didn't have insurance under the ACA, and can open up the government coffers to spend on you for your health insurance. In reality, all these tools and more are in use in the American healthcare system today. Ultimately, the most prevalent form of government intervention in the US healthcare system is the creation of a multitude of programs across levels of government. These programs actually provide health insurance depending on specific classes of individuals. Basically, if you meet certain criteria, you're eligible for one of a multitude of programs. When we think about these programs, often we hear the term entitlement. Basically, it's the idea that you have a right to something. That right depends on your class. Your class could be your age, your income status, or even something like if you're a veteran or a civilian. In considering these entitlement programs, we'll look through the four big ones: Medicare, Medicaid, SCHIP, and the VA. And to understand them, we need to answer several questions. First, who's entitled to this entitlement program? Second, where does the money to fund it come from? Third, what benefits do you get in general, or basically, what's covered? And then finally, what challenges do these programs face today? All right, let's start off with one of the largest entitlement programs, Medicare. First off, who's entitled to this program? Traditionally, it was the elderly, basically the 65 plus population. But we've since expanded it to allow disabled individuals onto this. We call this Social Security Disability Income, or SSDI. Based upon your level of disability, you can automatically get Medicare, a certain type of it, for up to 24 months. How do we fund Medicare? Well, we call Medicare a contributory program. Basically, it's funded by future individuals or future beneficiaries. Current wage earners face a payroll tax. They make their contributions today with the hope that when they're 65 or older, they'll be able to draw upon Medicare. So what is this payroll tax? This is FICA, the Federal Insurance Contributions Act. If anyone's familiar with the old television show Friends, the episode where Rachel gets her first paycheck for working down the coffee shop, she looks down and sees FICA and says, "Who's FICA and why is he taking all my money?" All right then, what does Medicare actually cover? Well, Medicare has evolved over the years and has been broken down into four different parts. There's Part A, which is your hospital care. This is your acute care, and basically elderly individuals, if they need to go to the hospital for emergency, don't have to pay a premium each month, basically a bill each month for that service. Yet we don't just go to the hospital when we need care. We also seek physician care. This is where Medicare Part B steps in. However, seniors have to pay a premium, or essentially a bill each month for access to that service. It comes out to roughly about $100 a month. Yet there are certain things missing from this list, like dentist visits, optometrists, etc. In the late 1990s, we added Medicare Part C, which allows for the creation of managed care. Private insurance companies sell Medicare insurance supplements. This allows elderly individuals to purchase essentially upgrades to their health care and add in things like dentist visits, auditory visits, optometrists, etc. But if you're keeping track, there's something still missing from this list: prescription drugs. In the late 2003, during the Bush administration, they added Medicare Part D, which allowed coverage for prescription drugs. You put these four benefit parts together, and ultimately, elderly Americans are fairly well cared for by Medicare. So then, what challenges does Medicare face today? Well, the system has become highly complex. It's difficult to navigate from the Part A to the B, figuring out can you afford Part C, as well as Part D coverage as well. The biggest problem facing it is the retirement of baby boomers, and ultimately then what that means for the costs and the funding of Medicare. Really, since 1980 through basically 2030, the 65 plus population will triple. And as this group ages further, they're going to draw more heavily on Medicare benefits and cost the system more. If you look at this, right now, Medicare costs about 15% of our overall budget. As more and more baby boomers retire and get older and draw upon more care, this number is expected to increase even further. So then, what do we do to fix this problem? Well, that's up to you.